Hello students, myself Ms. Deepika Farikar. I am from Rawatpura College of Nursing, New Raipur. Today I will take the Child Guidance Clinic. So first of all, the introduction. The Child Guidance Clinic was started in 1922 as a part of program sponsored by a private organization as a Commonwealth Funds program for the prevention of juvenile delinquencies. The first child guidance clinic was started in India in 1939 at the Tata Institute, Mumbai. The child guidance clinic in Delhi was started in 1955 at Rock Constitution simultaneously with the Madras. So now I deal the definitions. So the child guidance clinic are specialized clinic that deal with the children of normal and abnormal intelligence exhibiting a range of the behavior and psychological problems which are summed up as maladjustment. A child guidance clinic is one of the medico-social amenities for the organized and scientific study and treatment of maladjustment in the children. So the child guidance clinic is a provide to all over development of the child in this clinic and improvement to the children's for promoting their wealth and good health and living in the society as a common and useful member. So next one there the concept of the child guidance clinic. First of all, it is for the all-round development of a child and the children's physical, psychological functioning and the environment to which he is exposed at home and school should be taken care of. All this is possible through interaction with counseling of a child and his family by healthcare team. So first concept in the denoted that the all over development of the child, the physical also and the psychological also, and they have to take the home environment for the children's and with the counseling to the parents with efficient family member and effective activity with the healthcare team. So next one is the objectives. First, objectives of the children's. These child guidance clinic provide for those children with behavioral problems like the pica. This condition, it is the behavioral disorder. That means the children's having a non-nutritious food they have to take. Next one is the bedwetting, sleepwalking and speech defects. So these conditions affected to the children's. So the child guidance clinic provide the first of all in the behavioral problems. Secondly, the providing a care and guidance for children with mental retardation. Thirdly, the providing a care of children with the learning disability. Those children they were not taking proper calculation, mathematical or otherwise in the attention activities they have to maintain in the child guidance clinic. Next one, objectives is the providing a counseling, guidance and information to the parents regarding care and upbringing of the children. So what are the services provided by the child guidance clinic? First of all, the child guidance clinic provide to managing the behavioral problems. What are the behavior problems? Comes in the infancy periods also the childhood period and the adolescence, they have to provide the child guidance clinic by the appropriate assistance. Next one, the learning disability, promoting the learning disability, the provide is the services by the child guidance clinic. Managing the emotional problems. Next one is the managing adjustment problems. Next one is managing the developmental problems those children have in the not neuromuscular activities. The condition is having provided the managing to the developmental problems. Next one is the intellectual deficits like attention deficit, hyperactivity disorder. In that condition, the child guidance clinic is provided. Managing the social legal issues. Some societies having in the some law, these problems is managing in the child guidance clinic. Like example, some antisocial activity done by the children's within underage. So this child guidance clinic is provided. So now, what are the principles of the child guidance clinic? So the principle of the child guidance clinic, it is a treatment of the child is carried out not by one person but by a team of workers. The team of a staff member is constituted of a psychiatrist, a pediatrician, and a public health nurse, and educational psychiatric social worker and playroom worker. That means the child guidance clinic, it is associated with the all whole staff required for development of the children's. Next one, the child is treated as a whole and the personality has many aspects like the physical, intellectual, educational, emotional, social, and economic. Each of these aspects is studied by the respective staff member who has specialized in the particular field. So the requirement of the all over staff, also the development of the all over aspects in the children's like physical, intellectual, educational, and emotional, social, and economically. So this staff is a well skilled and well qualified by their work for the children. So their treatment is divided into the two. First one is the treatment of the child himself, and secondly the family attitude such as a focus of the treatment. So first is the treatment of a child himself. The treatment of any physical illness if it is the present. Secondly, psychotherapy require first suggestion and the persuasion. Secondly, hypnosis, and thirdly the re-education and psychoanalysis. Next one is the play therapy according to their age group and with the expressive therapies. Next type, the family attitude such as a focus of the treatment. First of all, we have to identify the attitude therapy by to the parents, the treatment of psychoneurosis or psychosis if the parent, if and when necessary. So what are the role of nurse regarding the child guidance clinic? So first, the nurse can help prevent by identifying the risk cases in the community, educating the public for awareness. It is of research for studies according to the new cases or child guidance strategies for promote of the children. Next one is providing the holistic approach or all over care to the children. improvement of the child rights for proper growth and development, and prevent the illegal issues. Next one is it is provide the important role by the nurse, so they have to take of the education by the nurses to the teacher, parents, and bonding to the effective moral. Be an exemplary role model, that means providing the care by the parents, by the staff members, by the society, and all over the child guidance staff member, they have to provide to the children's necessary care. So these are the topic of child guidance clinic. Okay, thank you class for cooperation.